Dear fellow Toastmasters, my topic is long. To liberate or not to liberate, that is the question. I'm not talking about politics. No liberals involved. I am talking about MS, multiple sclerosis, not McDonald's sandwiches, but MS. This is a very serious topic. Remember the controversy saying about the liberation treatment? This is what I'm going to talk about. I'm going to talk about the definition of MS. I'm going to explain what the liberation procedure is. I'm going to tell you what the controversies are. And I'm going to tell you what we're going to do. This is the procedures discovered or invented by this Italian doctor. His name is not Zombie, but Sombani. He postulated that MS is from something caused by the blood flow problem. Your blood flow from the brain is somehow limited. If you have blood flow through some veins here to the heart to make it work, if the blood flow is somehow constricted and blood flow cannot go through from your brain to your heart, what will happen is this part, your blood inside your brain, will have increased pressure. And that will push some of the ingredient to leak out. You will have iron deposits, you have red blood cells, you have immune cells leaking out. Now, MS is a disease affecting neurons and nerves in your brain. For example, this is inside your brain. These are nerves. And inside, around the nerves, they're coating around there called myelin sheaths. See, what happens is, if these iron deposits and these immune cells attack this coating, the nerves cannot communicate. There will be no communication, and therefore the nerves won't work. And this is why a patient will have problem with the nerves. This is what this doctor thinks is MS causing by this vein problem. They have very narrow veins. So what this procedure does is try to take care of this problem. Imagine if your veins are narrow right here and the brain cannot go through. So what do? Something called angioplasty. What happens is they surgically have a balloon procedure in there, swell the veins up. If the veins are opened up, the blood flows again. If the blood flows again, no more leakage. No more leakage, no more deposits. No more deposits. These sheaths or protective layer work again. And communication talk again. And therefore, the nerves talk to each other. And therefore, your balancing, your movements improve. And this is how it is called a liberation procedure. Now, before the conclusion, I have to tell you the controversies. First of all, for this topic, Dr. Zamboni has done it on 74 patients. And over 2 years, there's no problems reported from these patients. But the sample he chose was very limited. To have an effective clinical trial, you have to have larger samples. You have to have independent studies. You have to have blind-sided studies. In his control, only 64% of the patients actually have vein problems. People who have vein problems also may not have MS. In fact, out of 44% of MS patients, they have neurological disorders. So you cannot say anyone have neck problems can benefit from it. They may not have MS. And also, this study has not been proven. There are 3 other scientists have tried to do similar studies. One of them found a little bit comparable results. But the other 2 have found no significance whatsoever before and after the procedure. And also, his studies have not included normal humans that had no problems. Because in MS, people have neurological problems, people have a lot of issues, and also a lot of people have no abnormalities in veins or whatsoever. So his studies are very limited. And also, to do a clinical trial, You have to make sure that there are legal aspects involved, you have to have safety procedures involved. And no hospital will provide a clinical study if they have no precautions and no control setup. So, what are we going to do? The MS Association of Canada and US in June, they have, which they have never done before, approved a $2.4 million grant to set up 7 projects to study on the effects of these vein anomaly procedures related to MS. And on Monday, Jerome Kennedy, our minister, have initiated a $320 project on doing an observational studies. And these studies is to find out people who are going to have this procedure done abroad, and when they come back, they want to compare if actually the results are working. And the Newfoundland project will complement the other 4 projects across Canada. In fact, last night or tonight, a federal minister, Eglugat, she mentioned if these observational studies or in other provinces come up positive, clinical trials may actually be starting in a couple of months rather than years. So this is good news. We are moving in the right direction. And just like Michelle said, Cope's formula, we have to try it out and then you'll find out new things. So the conclusion to me, liberation procedure is not a cure, even though it's a controversy, but it's a step in the right direction. Michael J. Fox once said, it has been proven time and time again that with adequate procedures and resources, the cure, the treatment, and the management and prevention of a disease can occur. I put it to you, shall we go ahead with this procedure? Or can we afford not to? Chairman.